we are going to see about the valve assembly. Okay, so this starting from the actuator up to the housing, up to the dip tube. Okay, this whole is nothing but this whole assembly is nothing but the valve assembly. Okay, so this valve assembly has different parts. Now, if you talk about the effectiveness of the aerosol, so an aerosol is effective only and only it depends upon three things. Okay, it depends upon the formulation. Okay, the effectiveness depends upon the formulation. It depends upon the formulation, which includes your propellant also. So it depends upon your propellant, it depends upon your formulation, it depends upon your container, and it also depends upon the valve assembly. So all these four basic components are very important in order to have effectiveness of your aerosol. Okay, pharmaceutical aerosol. If it has to be effective, then all these four components are very important, right? Now you don't want the formulation. Okay, this formulation must not chemically interact with the container, or they should not chemically interact with your valve also. Okay, now the container and the valve both, you want the container and also you want the valve. So this is the valve, it is starting from here, right, and it is ending up to the dip tube. Okay, so you don't want this container that we talked about earlier, you don't want this container, or you don't want this valve. Okay, sorry, you want this valve to withstand the pressure that is there present inside it. Okay, and secondly, you don't want the container, or you don't to get eroded, okay, to corrosion, or you want the valve to contribute in the form of the product. So the product that is given out of this container are in different form. It may be in the form of spray, it may be in the form of mist, okay, or it may be in the form of foam. Okay, so this valve is responsible to emit the product from the container in different forms. Okay, so you want the valve to contribute in this. Before we go ahead, let me tell you the different parts of this valve. It consists of your actuator, which is the button which starts the whole process. Okay, then you have the mounting cap. This is the mounting cap. This mounting cap, I said, is crimped onto the container. This is container head. Okay, this mounting cap is crimped onto this container head, right? You have the gasket. This is the gasket. Then you have the stem. This part is known as the stem. This part is known as the spring. Okay, and this stem and spring is present inside this housing. This is known as housing. Okay, so this spring and stem is present inside the housing, and to this housing from below a dip tube is been attached. So this is your dip tube which is attached to this housing. So these two are present inside the housing, whereas this tube is attached to this housing, right? So these are the different parts of your valve. We are going to see each of them in great detail. If you see over here in this figure, you can see actuator over here. On the top you have actuator, you have the stem which is placed over here, you have gasket which is below the mounting cup. Okay, then you have the spring that is present over here. The stem, okay, it goes inside the spring, and then it again moves up. As it moves up, your actuator is becoming on off. Okay, so this actuator becomes on with your pressure. As soon as you release the pressure with the spring arrangement, it goes off. Okay, then you have a housing, as I told you, which in which your spring and your stem is also present, and then you have the dip tube which is attached to this housing, right? So let us see one by one each part. Before that, what is the function of this valve? As we said earlier, it is used to expel the content in desired form. If you remember, I told you it is used to, the first function is to expel the content that is present inside the container in the desired form. What are the desired form? I told you it should be able to expel the content in the form of mist, in the form of coarse spray, in the form of solid stream, or in the form of foam. Okay, so it should expel the content in desired form, at desired rate, and in desired amount. Okay, that is the dose, what you call it. So desired form, desired rate, and desired dose. Okay, these are achieved because of your wall. Okay, because of this wall assembly, this is been achieved. As I told you, there are different materials that are being used, right? So different materials that are being used are, they should be, first of all, they should be inert, and they should be approved by FDA. Okay, whatever materials are being used. Different materials that are used are plastic, you have rubber material. So these are made up of different materials. So they are made of plastic, they are made up of rubber, they are made up of aluminum, they are made up of stainless steel. If you see your spring, it is made up of stainless steel. Okay, if you see your gasket, if you see your stem, okay, if you see your housing, many a time it is made up of plastic. If you see a gasket, it is made up of rubber. Okay, if you see your mounting cup, it is made up of aluminum. Okay, so different materials are being used in order to prepare this wall. There are two types of wall. You have continuous spray wall, okay, and you have metering wall. In continuous spray wall, the material, till if you press the actuator, then the material is going to get released in a continuous fashion. Whereas in a metered wall, exact amount of material is pressed, is given out, is expelled out once you press the actuator. So as soon as you press the actuator, the exact amount of material is coming out. Hence they are known as metered wall. Okay, because exact amount, metered amount of material is coming out. Whereas in case of continuous spray wall, once you give the once you spray, the continuous spray is going to come out. Not exact amount is going to come out. It is going to go on expelling the contents. Okay, let us move ahead with the different parts. Let us see the first part of your wall, that is the actuator. We have talked a lot about the actuator in my earlier part of a lecture also. As I told, actuator is nothing but a button. Okay, this is the actuator. This is the actuator that is present over here. Okay, it is nothing but a button which the person who is using it usually presses it, and this starts your the exact process of emission. Okay, which actually activates the valve assembly, and the emission of the product takes place because you are pressing this actuator. Okay, this actuator permits, okay, opening and closing of the valve. Once the actuator goes down, it opens the valve, the contents are expelled out. As the actuator moves up, when the pressure is released, then what is happening is the valve closes, and the exit of material, expelling of material is been stopped. Now the design of the valve, okay, from inside, the size of the orifice, that is over here, the size of the orifice, okay, and the design of the valve as such, they both decide upon the contribution to the physical form. Whether the material is going to come as mist, whether the material is going to come as coarse spray, whether the material is going to come as solid stream, or whether it is going to come as a foam. It has been decided by the internal design of the internal chamber, and also with the size of the omission orifice. Just for an example, if you want it to come as a foam, if you want the product as foam, then this orifice should be bigger in diameter. Okay, whereas if you want to come in the form of mist or in the form of coarse spray, then the size of this orifice should be smaller. Okay, now also the particle size of the emitted product depends upon two things. It depends upon the type and quantity of propellant, which we talked about earlier. Okay, and it also depends upon the actuator design and dimensions, which we talked about now. So it depends upon the two things, the particle size. Just for example, if the orifice is larger, okay, and the quantity of propellant is less, then the type of emission is near foam type or solid stream type. Okay, if the orifice size is smaller and quantity of propellant is more, then the form in which the material is expelled out, it is in the form of spray or it is in the form of mist. Got it? Any problem you have up to now? Any problem? Any question in chat box? I forgot to see the chat box. Okay. Anything that you want to ask me up till now? With respect to the container, with respect to the wall, we have just started with the wall. That is why I finished with the actuator. Anything that you want to ask? Moving ahead with the actuator. Okay. Let us see the different types of actuator. Okay. You have different types of actuators, that are spray actuators, foam actuators, solid stream actuators, and special actuators. Now, this is on the type of product that is being expelled out, the form in which the product is being expelled out. For expelling the product in the form of spray, you have to use spray actuator. For expelling the product in the form of foam, you require foam actuators. For expelling the product that are present inside the container in the form of solid stream, you require in the form of solid, you require a solid stream actuator. And there are some special actuators which delivers the medicaments into your throat, nose, or dental cavity or your eyes. Okay, for that you have special kind of actuators. Okay, let us talk about the spray actuators. The first type of actuator, that is spray actuators. Now these kind of actuators are basically used for antiseptic, spraying your antiseptics. Okay, they are basically used for your local preparations, like spraying your antiseptics, spraying local anesthetics, okay, or counter irritants, just like move, etc. Okay, this is your antiseptic, which first aid antiseptic which spray if there is some if you get hurt, etc. Right? Then counter irritants like move, release spray, you know them very well. Local anesthetics, okay, in order to make some part numb, if you want, then you can have local anesthetics. Then you have spray on bandages. These all are the type of your spray actuators, right? What does this spray actuators do? It allows the stream of product concentrate, okay, and propellant to pass through various openings, okay, and dispense in the form of spray. So basically what they do is the product concentrate goes through your dip tube, etc., further to the housing, okay, to the actuator, and through the actuator it is being dispensed in the form of spray. Okay, you have foam actuators. As I talked about foam actuators, it has larger orifice ranging from near about 0.070 to 0.125 inch. So that is near about the orifice diameter. Okay, it is quite bigger in nature, right? Then you have solid stream actuator. In solid stream, what is been dispensed usually is the semi-solid products. You must have seen many semi-solid products which when you press, the small quantity of material comes out from the container. I have one of the containers. I'll just take the photo. I forgot to place the photo over here. These are the types of foam actuators. If you see Gillette, etc., the shaving cream usually they come in the form of this foam actuators. Many face washes are also coming in the form of foam actuators. Okay, so your solid stream actuators, basically they dispense the product in the semi-solid form. Okay, then you have special actuators that I talked about. They are used for specific purpose. They deliver the medicaments to the site, appropriate site. That is in case of in as throat. So these are the types of actuators. Okay, then dental, you must have seen when the dental surgeries, etc., root canal, etc., carried out, then the doctor uses special kind of spray, okay, in order to clean that surface, okay, or in order to have local anesthetic of your dental cavity, isn't it? So of your dental area. So those are nothing but your that those have been achieved by your special actuators. Okay, that is the dental actuator. Or when the medicaments is given inside the nose, okay, as you see over here, that time also you have to use special kind of actuator. So this is the special kind of actuator that is being used in order to deliver the medicaments inside the nose. Okay, or in case of the eyes also you have to use special actuators. So these are the different types of actuators that have been used. Okay, the next type of the next part of your wall is your stem. Okay, now this is the stem. Okay, if you see over here, this is the stem. This is how the stem looks like. Okay, okay, it basically supports the actuator, okay, and delivers the formulation in the proper form to the chamber of the actuator. So from the dip tube, okay, the material is dispensed or given or delivered inside this actuator through this stem. Okay, they are basically made up of nylon or durlin. They are also made up of brass. They can also be made up of stainless steel. So these all materials have been used in order to prepare a stem. Usually the orifice is 0.013 to 0.030. Again, depending, so this is the orifice if you see over here. Okay, this is the orifice that is present. Again, depending upon in what form the material is to be given, this orifice diameter is going to change. Okay, so it basically supports the actuator and delivers the formulation, okay, in the proper form to the chamber of the actuator. So that is the function of this stem. The next part is the gasket. So this is the gasket. Okay, it is basically made up of rubber. Okay, two types of rubber are used, Buna N or neoprene. These types of rubbers are being used. What they do is they prevent the leakage of the formulation when the valve is closed. So if even if your container is tilted, etc., then the formulation does not come out. Okay, this leakage of the formulation when the valve is closed is done by your gasket. Okay, this gasket are placed snugly. It means it is just placed onto this stem. Okay, they are not attached or they are not fixed. They are just placed above the stem. Okay, you have to remember that this gasket, this stem gasket, okay, seals the wall. Okay, the wall is still sealed by the gasket, right? Understood? So this is the second part, that is the third part, that is the gasket. Moving ahead, okay, the next part, that is the spring. Okay, now what is the spring responsible? The spring, as I told you, is responsible to close the wall once the pressure is being released. So in order to open the wall, what you do is you apply the pressure on the actuator. So on the actuator, what you are doing is you are applying the pressure. The medicaments is being thrown out. So from here the medicaments comes out. And then what you do is you release your pressure. As soon as you release the pressure, this spring, okay, when you are applying the pressure, this spring is contracted. As soon as you release the pressure, this spring moves up, whereby the stem moves up and the actuator also moves up, right? And then it causes the closing of the valve. So it helps the actuator to retract when the pressure is released, retract and go to its original position once the pressure is released. Okay, and then the valve is closed. So the valve moves to the closed position, which is its original position. What does it do? It holds the gasket, which you have seen the earlier part, in place. So this is the type of the spring. So this is the spring, okay, which you see over here, and it is placed inside the housing. The spring and the stem, they are present inside the housing, right? And it is usually made up of, as I told you earlier, it is usually made up of your stainless steel. The next part of the valve is the mounting cup. Now mounting is also known as ferrule. Okay, now this is the mounting cup, right? This is the mounting cup. This mounting cup is attached to the container with the help of crimping. So this is the mounting cup. Okay, a side view of the mounting cup. Okay, this part over here. Okay, this is the mounting cup, and this is attached to the container. This is the container. This is attached to the container with the process that is known as crimping, right? And this mounting cup, it carries the ball along with it. So the ball, the other parts of the ball are attached to the container with the help of this mounting cup, also known as ferrule, as I told you. So it is attached to the aerosol container and it holds the valve in place. So the valve is in place, okay, inside this container or attached to the container with the help of this mounting cup. Now, one more thing that you have to remember is the actuator that is not in contact with the product, okay. The spring, the what you call that, the stem, they are present inside the housing. Okay, so this is the housing where it is present inside the housing. Whereas if you see, this mounting cup is basically in contact with your product. Okay, and as this housing is mounting cup is in contact with your product, hence many a time it is coated with an inert material. Okay, that is just for an example, you can give the coating of epoxy or vinyl as you give the coating for your metal. It is also made up of metal. These housings are basically made up of the metal. So this is also another picture of your housing which is made up of metal. So you can see over here, this is also made up of metal. This housing, this mounting cup is basically attached to your steel containers. Okay, so whenever you have the containers which are made up of metals, okay, made up of aluminum, made up of your tin plated steel, okay, when they are made up of these containers, these mounting cups are basically activated, okay, as I told you, in the form of crimping. They are made up of, as I told you, tin plated steel, or they are made up of aluminum, or they are made up of brass. Now, as they are made up of these material, and as this material comes in contact with your formulation, hence they should be coated with the inert material like you coat your container. It may be epoxy, or you can give an epoxy, or you can give your vinyl coating, so that it prevents the interaction of your mounting cup along with your formulation. Okay, moving ahead with your next part, that is your housing. Okay, now housing is also known as valve body. Now, this is your housing. What does this house? Okay, why it is called as housing? Because it encloses or it houses, okay, your stem as well as your spring. Your spring and stem, they are present inside this housing many a times. Okay, also the dip tube is attached to the housing, okay, at the opening over here. So housing is having an opening, okay, at the bottom, and to this opening, okay, your dip tube is getting attached. So it encloses the spring as well as it encloses the stem, and many a times it also consists of an, we'll talk about it later, that it consists of a vapor tap also. So there is a tap over here, there is a hole over here which is known as a vapor tap. We'll talk about it in my next slide. It is made up of nylon, or it is made up of durlin, and it is having an opening at the bottom, as I told you, where the dip tube gets attached. This opening may be having different sizes. It ranges from 0.013 inches to 0.080 inches. Okay, so it is having different size depending upon the dip tube. Okay, and the dip tube size depends upon the viscosity of the material and the form in which you want to give the material, right? As I told you, it is placed directly below the mounting cup. So you have your actuator, you have your mounting cup. Below the mounting cup, your housing is present. Okay, inside the housing you have your stem as well as your spring. Now, along with the stem, the orifice that is present, okay, in the housing, the orifice that is present over here, there is an orifice in the stem, there is an orifice in the actuator. Okay, the orifice that is present, okay, this helps along with the stem, okay, along with the orifice that is present in the actuator, it helps the delivery rate, okay, and the form, whether it's going to be in the mist form, it is going to be given in the spray form, or whether it is going to be given in the foam form, okay, and the rate at which it will be given, this is determined by the orifice that is present over here. okay, and the product that is emitted. This is also known as, this also act as secondary metering orifice. So if you see over here, there are different types of housing. You can have a standard housing, you can have a capillary housing, you can have a jumbo housing, and you can have a inverted housing. So these are different types of and housing that have been present. Now, as I told you, housing has a hole which has been present, okay, inside it. It may be present, it may not be present, okay. So sometimes a hole is being present. This hole is known as a vapor tap, okay. Now what is a vapor tap? A vapor tap is nothing but a hole that is present in the side or that is present in the bottom of the housing. What does this vapor tap helps to? It helps the escape of vaporized propellant along with the liquid product, okay. Usually used when the propellant is immiscible with the product concentrate. So if the propellant is immiscible with product concentrate, okay, that time, in order to escape the vaporized propellant, this hole, that is this vapor tap, is going to help us, okay. It also produces a fine particles. It also helps to produce a very fine particle size, and this also helps in preventing the wall clogging, okay. The clogging of the wall is prevented because of this vapor tap, okay, when the products are insoluble materials are present, that is in suspension aerosols, okay. This wall clogging is being helped because clogging of wall is being prevented because of this vapor tap, right. Now, as I told you earlier, it is usually used when the propellant is immiscible with the product concentrate. The usual size of the vapor tap is near about 0.005 to 0.040 inch, and if vapor tap is present, then it produces a drier and a warmer kind of a spray, okay. So this is all about the housing that is present. Let us move to the next and the last part of your wall. The last part of the wall is nothing but your dip tube, okay. So a dip tube, it starts right from your housing, so it is attached over here, and it goes down up till the product, okay. So it starts from the housing and it enters inside the product and it goes deep down to the bottom of the container. What does it helps to do? It helps you to bring the formulation that is present over here, the actuator, okay, to the wall, okay. So to the top part of your wall, the formulation is brought, okay, from the container to the top part of the wall with the help of this dip tube, to the actuator with the help of this dip tube. Now the dimension, okay, or you can say the inner diameter. So whatever is the inner diameter or whatever is the dimension of this dip tube, it depends, as I told you earlier, it depends upon viscosity of the product, okay, and also what is the delivery rate that is required, okay. Now there are different types of diameter. You have a capillary diameter, like you have different housings. In the similar manner, you have different inner diameter of your dip tube. So you can have a capillary dip tube which is having the size which is less than 0.060 inch. You can have a standard dip tube which is 1/8 of an inch, that is 0.122 inch inner diameter. You can have a large what you call that dip tube, okay, large inner diameter dip tube which is near about 3/16 of your inner diameter, having 3/16 of the inner diameter, that is near about 0.190 inches, okay. Or you can have a jumbo. So these are the different sizes. So this one is the jumbo one, okay. So jumbo is having near about near about 1/4 of the 1/4 inch of the size, which is near about 0.260, okay, inch. So that it depends upon what is the viscosity. If your viscosity of the product is too high, then you have to go for a jumbo one. If your viscosity is less, then you can go for a capillary one also, right. So you can have different size, and depending also upon the delivery rate, you are having different inner diameters of dip tube. Now usually the dip tube is notched at the bottom, okay. So this is the notch type of a dip tube, isn't it? You basically have a notch type of a dip tube so that it prevents the closing off. So when this container is, it goes up to the end, it should not get closed off because of the base of the container. So this closing off of the base of the container, this closing off of the dip tube with the base of the container is prevented because of this notch type of a dip tube, okay, where it has been cut from bottom, so that the contents, the last part of your formulation also comes out, right? So it prevents the closing off of the bottom at the bottom of the can. This dip tube, you can see, also has a curvature, right? This curvature helps you to expel the full content of your container, of your formulation, okay, of your product concentrate, okay. More so ever when it is a downward kind of a spray. This is how is a downward spray, where you tilt the container and then you apply it on the surfaces, etc., or on the topical on the skin, etc. So this is the way you apply it. So you will going to have a product concentrate in this fashion, right? Okay, when you tilt it. So this all product should come out, formulation should come out basically in a downward spray. Hence, this dip tube is usually having a curvature, which you can use for your own advantage, right? This is made from polyethylene. Okay, dip tube is usually made from polyethylene or polypropylene. As I told you in my last lecture, these dip tubes are this contain material that is used in the wall are different kind of material. You use rubber, you use plastics, you use metals. Okay, so different materials are used for preparing this. You use stainless steel, okay, for preparing this wall. Moving ahead, okay, with the metering walls. Now up till now we have seen the parts of the wall, okay. These parts of the wall are for continuous spray. I told you there are two types of spraying system. You have continuous spraying system, okay, whereby the material, once you press the actuator, okay, the material starts flowing out and it is in the continuous fashion. Whereas in metering wall, when you press the actuator, okay, right dose of material comes out and the spray, the giving out of ingredient, okay, it stops, right? These types of walls are known as metering walls. So this has been achieved with the help of the metering wall. These are basically used in MDIs, that is metered dose inhalers, okay. And these are used basically when you are dispensing potent medication, okay, like in case of asthma, etc. Whenever you are giving potent medications, in that case you use this metering walls. Now this metering wall consists of all the components which are similar to your normal wall, right? So it also consists of an actuator. It also consists of a gasket system which is present below as well as on the top, okay. It also consists of your steel spring. It also consists of mounting clamp, okay. So all the ingredient, all the parts that are present in your normal wall, okay, continuous spray wall, these all are present over here. Apart from that, it consists of a unique chamber that is known as the metering chamber. So it uniquely consists of a metering chamber. This wall consists of a metering chamber, okay. Once you press this, this is the usual shape in which the metering walls are being meter dose inhalers are available, okay. So this is the structure of a meter dose inhaler. When you press this aluminum canister, okay, that is the container. When you press this container, what happens is the actuator that is present below. So this is the inverted form. So this is the part of that container, the top part of the container, okay. This actuator, it gets pressed. As soon as it gets pressed, whatever are the contents that are present in this metering chamber, okay, this content that are present inside the metering chamber, they are getting released, okay. As soon as they get released, the further whatever the material is present inside the container, it occupies this place again. When you again press it, okay, when it is actuated, again this contents, they come out and they go inside the patient, and this process is repeated. So once you press this actuator, okay, then what happens is the amount of drug that is present, the amount of formulation that is present inside this metering chamber, only that much amount is going to go inside the body of the patient. What does this help is, it helps to minimize the errors in the quantity of dose. So the right quantity of dose is going to go inside the patient. The size of this metering chamber, it decides the quantity of medication that is going to go inside the patient. Okay. What else does it do? It also helps improves the drug delivery of an aerosol particle. Okay, when you are giving it to the respiratory tract. Okay, right. Let us move to the advantages of the meter dose inhalers. Okay. The meter dose inhalers, they have deliver specified amount of dose, as I told you earlier. So this much quantity of dose is only going to go inside the patient. They are very portable, as you can see over here. These meter dose inhalers, MDIs, are very portable. They are very compact. They are quick to use. Okay, it does not contaminate the product like the other aerosols. Okay, aerosol container, this also does not contaminate. No contamination of product takes place, as it's totally closed. The contents are totally closed and not exposed. Okay, and the dose to dose reproducibility is very high, right? It consists of a metering wall. So you have meter dose inhalers. These meter dose inhalers, what they do is, they house the metering wall, and this metering wall, what it does, quantity of dose to the patient. There are some disadvantages also of this metering wall. Usually you fire very high lung deposition. You're using this wall basically, metering inhalers, they are basically used for by asthmatic patients, whereby you want the amount of most quantity of drug to go to the lungs, but you will find that the drug usually is up till the pharyngeal area only. So there is only 10 to 20% of lung deposition or the reach of the drug up to the lungs. Okay, and when you are taking this metering wall, when you are using this metering wall, there should be a proper coordination between the actuation, that is when you press this pressing is nothing but the actuation. It is pressed by the patient. So pressing of this, that is pressing of this canister, or you can say activation of the meter dose inhalers. Okay, actuation of this meter dose inhaler, and the patient inhaling the substances, that should be properly coordinated. If that comes by proper training, and after using this what you call the meter dose inhalers many a times, that coordination usually comes in the patients. Okay, so if that coordination is not there, then you are not going to get the adequate result. Okay, so the patient should be properly trained in order to use this meter dose inhalers. Okay, so meter dose inhalers contains this metering wall, right? So there are two types of wall: continuous spray wall and metering wall. Continuous spray wall are present in all the different other aerosol containers, whereas metering walls are present in meter dose inhalers. Metering walls are also have the part similar to your aerosol, others continuous spray walls. Okay, with the only difference that it contains the metering chamber. Okay, and we have also seen the advantage and disadvantage of your meter dose inhaler.